Well, it's a big week for Radiopharm Theranostics. The Australian biotech is listing on the ASX this week after raising $50 million in its IPO. Renowned Australian biotech entrepreneur Paul Hopper is founder and chairman and joins us now for what is a significant period of time. Welcome to Ticker News today.
Good afternoon. Thank you for having me.
So tell us, exciting week. Why now exactly to head towards the ASX?
Well, we did an earlier raise for about 20 million, and given the scale of the company's portfolio, we did need substantial equity to get the programs through the clinic. So now was the time, and the market seemed to have an appetite. We were heavily oversubscribed when we raised the 50 million. So we're well set up to get on with developing these drugs.
So tell us perhaps more, Paul, about your history leading into this. What brings you to this point?
Right, so I've been involved in the biotech industry for a number of years across mainly cancer companies involved in immuno-oncology. So this is a slightly different approach from what I've been used to, but my previous companies have been companies like Imugene, which is now the biggest biotech in Australia with a market cap of about $3.5 billion. I floated what they call a CAR T cell therapy company in January on the ASX. So this is a continuation of what I do in the biotech industry.
So tell us more about the problem that you're looking to solve here when it comes to Radiopharm Theranostics. I'm sure plenty of people out there get a little bit confused. Of course, it's a pretty challenging and layered sort of conversation. Well, what's the problem here that you're solving?
Okay, so you're quite right. It is a little bit complicated, but basically it's nuclear medicine. And most people would be aware of that because it's been a pillar of medicine for years. That is where you take images and you light up cancer tissue or actual organs, and you take pictures of them, and then the doctor can look at it and decide which way to go in terms of cutting it out or how to treat it. What we're doing here is we are looking at treating the cancer using radioactive material, which are called radioisotopes, and we attach those to things called peptides or antibodies by a type of chain, and when you inject the antibody, it drags the radioactive isotope up to the cancer and essentially fries it, so to speak, like a nuclear warhead. So we're attacking we're attacking breast cancer, pancreatic cancer, head and neck cancer, lung cancer, so a whole bunch of cancers that have proved pretty hard to treat in the past.
And tell us about what you're up to at the moment in particular. I believe you've got technologies which are in 5 phase 2 trials and 2 phase 1 trials. So a broad area. It sounds like there's a lot going on right now.
Yes, so we're running clinical trials because clinical trials are where the rubber really hits the road with patients. Up until you get into a clinical trial, it's all rather theoretical. So we've got, as you say, 5 phase 2 trials and 2 phase 1s in those diseases I just mentioned, and those trials are being conducted in London, Germany, Sweden, and in Shanghai, and they're ongoing at the moment.
And Paul, just to finish, tell us about the IPO. I believe it was met with pretty strong interest from investors locally and also overseas.
Yeah, we had very strong support. I think we had approximately in excess of 100 million bid into the book. We didn't need that amount of money, so we took the 50 which we set out to raise. We got very strong support out of Hong Kong and from many of the major biotech investors here in Australia. So we have a very good share register, and there's a lot of crossover in the investors between Radiopharm and Imugene and Chimeric, my other companies.
Exciting times ahead. Paul, thanks so much for sharing today. Keep us up to date with all the trials, and for now, how do we keep track with all the work moving forward?
Right, so we have a fairly strong policy of informing our shareholders what we're doing, notwithstanding the fact that we have an obligation anyway under continuous disclosure with the ASX. So anything that we feel is relevant or material, we'll be doing a press release, so you'll see plenty of news flow over the next 6 to 12 months.
Great stuff. We'll talk again soon. Thanks for your time, Paul.
Thank you very much.